Retinal detachment is not common, but it can be very dangerous and can result in a complete loss of sight if left untreated. After retinal detachment surgery, the patient needs to follow the ophthalmologist's advice very closely. It is important to follow these steps to ensure the retina is returned to full health. 1. Sit or lie down in the position that your doctor has advised. For example, always look on the floor. Lie on your shoulder or lie with 30 or 45 or 60 degree or lie flat on your back. 2. Avoid shaking your face or head. Try to avoid sneezing and do not lift any items heavier than 15 kilograms. 3. Prevent water entering the operated eye for 14 to 21 days up to 1 month. This may depend on the circumstance, but always follow the advice of your doctor. You may take a shower, but be careful to not allow any water to enter your eye. 4. If you want to wash your hair, you should tilt your head to the back so water and shampoo will not get into your eyes. You may go to the salon, however, if advised, not to lie on your back. This should be avoided. 5. Clean the operated eye properly and follow the doctor's instructions closely. 6. Apply eye drops as directed. In case you forget to use eye drops, you must apply as soon as you remember. Continue your full course as prescribed by your doctor. 7. Do not rub your eye and avoid applying pressure on the eye. Place the eye shield every night for 14 to 21 nights, up to 1 month, depending on the advice from your doctor. During the day, you can wear glasses to protect your eye from unintentional scratch, rub or bump. 8. The doctor will inform you when and if to take any other medication. 9. If a gas bubble was placed in your eye, do not fly on an airplane or travel to high altitudes until your surgeon gives you approval. You may resume your normal diet following surgery. However, if you have any special dietary constrictions, please check with your doctor. Both the patient and the caregivers must be familiar with the steps of how to clean the eye. Firstly, prepare the saline solution and sterile swabs and follow these instructions. 1. Wash your hands with soap. Rinse with water and dry them with a clean towel. 2. Carefully remove the protective eye shield. 3. Open the saline solution and put the cap face up to avoid contamination. Careful not to touch the inside of the lid or the bottle top. 4. Open the sterile swabs package and remove the sterile swabs one by one. Be careful not to touch the end of the swab. You need to use it to clean your eye. Avoid touching the rest of the swabs when using. 5. Rinse saline solution to both of the ends of the swab. Do not let the bottle top touch the swab. 6. Ask the patient to open their eye and look downwards. Hold the swab in parallel angle with the patient's face and wipe the upper eyelids first. Start wiping gently from the inner corner of the eye to the outer corner. Do not wipe back and forth. 7. Use the other clean end of the swab to clean the upper eyelid again, then throw it away. If the eyelid requires further cleaning, use a new swab and repeat the steps again. 8. After the upper eyelids are clean, ask the patient to look up and start cleaning the lower eyelids. Repeat the process used previously, wiping gently from the inner corner of the eye to the outer corner until clean. 9. Finally, to clean the inner corner of eye area, place a swab directly at the corner of the eye, then twist outwards toward the nose. 10. In case the doctor advises against looking up, raising your chin, you must clean the eye while sitting or lying on your side. The patient looks downwards whilst cleaning the upper eyelid and look straight when cleaning the lower eyelid. 11. In case the patients are alone, they may lie on their front and use a mirror placed on their lap to help cleaning adequately. Cautions. 1. It is important not to reuse swabs. Once a swab has been used, you must throw it away. Always use a new swab if more cleaning is necessary. 2. When you wipe, always start from the inner corner of your eye to the outer corner. Do not wipe back and forth along the eyelid. After cleaning the eye, the patient must know how to apply the eye drops and eye ointment. Once the sterilized swabs, saline solution, eye drops and ointment are prepared, please follow these steps. 1. Wash your hands and dry them with a clean towel. 2. Open the eye drop or eye ointment. Do not let the bottle top touch your fingers. Always put the lid upside down or on the side to avoid contamination. 3. If your eye drops need to be shaken before using, flip the bottle 2 to 3 times before opening. 4. Hold the swab at the end. Leave the other end clean. 5. Ask the patient to lift their chin up and look up to their forehead, and ensure their eyelashes won't touch the drops. 6. Using the non-dominant hand to hold the swab, gently touch the lower eyelid and pull the skin down to make an eye pocket. Use your dominant hand to hold the bottle of eye drops and bring it to 1 to 2 centimeters from the eye. Gently squeeze 1 drop into the eye pocket. 7. If your doctor has recommended not looking up, it may be difficult to apply the drops. In this case, apply the drops to sterilized paper, which will then be placed against the lower eyelid. 8. Close your eye gently for 30 to 60 seconds. Use a swab to gently dab your eye if it waters. When you need to apply eye ointment, in most cases, you need to apply eye ointment before bedtime, and it's always the last thing after applying the eye drops. Follow these procedures. 1. Ask patients to lift their chin and look up to their forehead and ensure the eyelashes will not touch the eye ointment. 2. Use a clean middle finger or holding a swab with your non-dominant hand. Pull the lower eyelid down gently until you make a pocket with your lower eyelid. Use your dominant hand to squeeze the eye ointment tube and then apply ointment in the pocket from the inner of the eye to the outer of the eye. Do not let the bottle top touch your eye, eyelashes, fingers, or any other surface. The patient can now close their eyes. Follow the procedure and instructions as closely as possible to what we described. You may change the timetable according to your situation, but it is important to maintain the prescribed amount of drops per day. In case you forget to use eye drops, you should apply the drops that you missed in as soon as you remember. After that, continue your course as prescribed by your doctor. If your operated eye has glaucoma, you may be given a new bottle, even if there is still some solution remaining. After this time, throw the old bottle away and use a new one to avoid contaminations. This will help to prevent the risk of eye infections. Things to know about eye drops and ointment. When using 2 or more eye drops, wait about 5 to 10 minutes after applying the first medication before applying the next. If the patient is prescribed eye drops and eye ointment at the same time, eye drops should be instilled first, then the eye ointment. You may have some blurry vision for a few minutes after applying the ointment. This is normal. After applying the eye drops, the patient must shield the eye with the protective eye shield provided. to place the protective eye shield correctly on the eye, it is important to follow a number of steps. 1. Clean the eye shield every day with water and soap. Wipe it with a clean towel until it is dry. Do not use alcohol or hot boiling water. 2. Cut medical tape into 3 pieces, each 5 to 6 inches in length. Fold one end of the piece of tape ready for use once the eye shield is in place. 3. Place the shield onto your operated eye in diagonal direction. The curved side of the shield should be on the cheekbone or end of the eyebrow with the straight side at the nose area. 4. Attach the first piece of tape on the inner edge near the nose, the second along the outer edge over the cheekbone, and the third strip on the outer edge toward the eyebrow. Make sure it's tight and fits the face to prevent the patient from touching the eye during sleep. 5. If your doctor has requested you to place a gauze underneath the eye shield, cut 2 plasters of 4-inch square and start by placing the gauze on your eye, then place the eye shield on the top. We suggest you to wear sunglasses or wind protective glasses in the daytime to prevent rubbing. The patient is able to exercise fully, except activities which require periods with the head below shoulder level or strenuous activities. Try to avoid vigorous coughing or sneezing. If this is becoming a problem, please consult your doctor. When sneezing, it is important to open your mouth to release any pressure. Avoid any forceful straining, including during bowel movements. It is important to take care of yourself. Follow all directions from your doctor and the information in this video, including attend every follow-up appointment to ensure you have a safe, healthy, and speedy recovery, and more importantly, you can return to your happy and normal life. Rutnin Eye Hospital wishes you all the best with your treatment.